Doctors Tea Party? Yeah, Doctors Tea Party US, actually, .us is the website. Dr. George Watson is with us, and one of the founders of the Doctors Tea Party. Doctors wear your white coats everywhere, big signs and banners looking at the website. Hey, Dr. Watson, welcome to the program.
Good morning, Tom. How are you?
Fine, and I promise no Sherlock Holmes jokes. Why would doctors need to organize tea parties?
Well, doctors who are seeing patients in everyday practice were not consulted when the meetings were done on the Patient Protection and Affordable Care Act, and so now it's time for doctors to speak out on behalf of their patients.
So we have the doctors with groups that are advocating national single payer programs on one end of the spectrum, and we've got guys like you on the other end of the spectrum. Seems like quite a discussion. You are an osteopath. How many other physicians, osteopaths and MDs, DOs and MDs, are with you in this?
Well, nationally there are well over 3,000 and growing, and we are what you might call the Delta Force of medicine. We are not out to get big groups of people. We're out to get the doctors who are ready to be active and committed in the political arena.
The Physicians for National Health Care, PNHC, I believe it is, has 15,000 members. I think you've got a little catching up to do. But the question, why would you, for example, we've got, like, just to take one company, my favorite example, frankly, United Healthcare, one of the largest of the health insurance companies. Their previous CEO, the guy that the Wall Street Journal refers to as Dollar Bill Watson,
no relation.
Yeah, actually, that's not his last name. I'm forgetting his last name. In any case, he took $1.78 billion in compensation for 10 years' work. The current CEO, Stephen J. Hemsley, for his first 5 years of work, took $477 million in compensation. How could any doctors group in good conscience say that these should be the people who are telling us what doctors we can go to and what procedures will be paid for?
Well, I totally agree with you, Tom, and that's why I don't agree with Doctors for National Health Care, because
PNHC wants to put these guys out of business.
Well, we do too. We don't want to have any third-party interference. That's the problem. When third parties get involved, whether it's insurance companies or the government, then healthcare takes second seat to bureaucratic action. And
so
we want to.
So you want me to pay for my health care with what? Chickens?
I've done trade, and
so you would take chickens?
I would take chickens. I took a fishing pole in trade 2 weeks ago, but most
I honor you for that. Actually, I think it's marvelous that you're willing to do that. But is that any way to run a national healthcare? I mean, we've got over 300 million people in this country, and we've only got about 7.8 million people in the United States whose net worth is over $1 million, and even that's not much these days when you consider housing values. There's not a lot of people who can actually afford to pay for health care out of pocket.
No, they can't if they're paying at insurance prices. And you made a very good point. People cannot afford to pay for health care if they're paying the inflated insurance rate. If a doctor opts out, as I have done, if they cancel their insurance contracts, they're able to charge a fair price.
Right.
And people buy cars, and they pay for those. And
if one of your patients, because you're not taking insurance, if one of your patients develops cancer and is going to need treatment that under the insurance scheme might cost $250,000, $500,000, under your program presumably will cost less, how much less is it going to cost, and where are they going to come up with that money?
Well, if a person develops cancer, we have what is called Medicaid, and they will go to the hospital.
Only if they're broke.
Well,
So you want people to give away or everything they own first so that they become poverty-stricken?
Well, that's what it is right now. And if they are covered under the Patient Protection and Affordable Care Act, they will not get any treatment. So they're even worse off.
Well, my understanding is they would be eligible for any treatment. I mean, they
would be eligible for any treatment that is approved. And with Mr. Berwick up there, or Dr. Berwick up there, heading the committee to determine what is approved, it isn't going to happen.
Right. So I get the bottom line is you don't trust the government bureaucrats to do a good job of offering health care.
No,
I'm suggesting that the health insurance companies aren't doing a good job of offering health care, taking $400 million in pay. You're agreeing with me.
I am.
What do we do as an alternative? How do we spread the risk among a large enough number of people that when an individual, the small minority of individuals who are going to require really costly care, don't get wiped out?
Well, that is happening right now in things like Christian Care Medishare and in the Samaritan Ministries and in the Amish population. Those people do not participate with traditional insurance plans, and if somebody gets a bill for $250,000, part of that is covered by direct contributions of other members.
So Dr. George Watson, you're suggesting that we should turn our health care program over to our churches?
It isn't a church program. It is a Christian-based program, but it is not affiliated with any church.
Okay, so we should turn it over to our religions.
Let me tell you that they do have an umbrella policy that handles things over $30,000.
Right, so they're dealing with these awful insurance companies that are making millions of dollars saying no to everything.
Well,
they're helping pay Stephen Hemsley's salary.
I totally agree. Those salaries are terrible, and the problem is we need to have the government cut out the clauses in their contracts that allow them to do some of the things that they do. Insurance companies have special rules and regulations that give them those advantages. Congress can change that.
Well, and that's the point. If Congress can change something, and Congress is elected by us, it seems to me that if somebody's going to be writing the check for health care, and somebody's going to be responsible for making sure that the risk is shared, rather than it being a private for-profit corporation that is absolutely unanswerable to us, and rather than it be an individual doc who maybe will, like you said, last week you traded a fishing rod for some medical services, but, I don't think that's going to cut it if somebody comes in with stage 4 bowel cancer or something. Isn't a representative, somebody who we can vote in and out of office, isn't that at least a reasonable middle ground where we the people have some say?
Well, we have an issue of cost, and right now Medicare is broke. And all of the congressmen and senators know that. Most of the public knows that. And the only way that you're going to control cost is if the patient is paying something at the time of service, because if the patient pays nothing, both the patient and the doctor have the opinion that, somebody else is paying for this.
Right, but Obamacare
so
also has minimums. But did you really say Obamacare is like slaves on a government plantation?
I said that any doctors who participate under Obamacare will be like slaves on the plantation.
Oh, that's a grim one. Well,
yes, it is.
I will leave it at that and let our listeners draw their own conclusions. Dr. George Watson, doctorsteaparty.us, the website. Thank you for coming by, sir, and talking with us.
You bet. Bye, Tom.
Yeah, good talking.